Assalamu alaikum, this is Shamama and today we're going to discuss a very important topic, that is genital herpes. Okay, now starting with it, today in this lecture, at the end of it, you will be able to know that what are the causative organism of genital herpes, what is its pathophysiology, how we will diagnose the disease clinically as well as on investigations, plus at the end how we will manage a patient of genital herpes. So these are the all points which we're going to learn in this video. Okay, so let's just start with our discussion. So starting with the first point, that is causative organism. So genital herpes is basically caused by the name herpes. You can remember herpes simplex virus. Now it's HSV virus, which is of two types, HSV1 and HSV2. Okay, now HSV1 is called, also called orolabial herpes. Now orolabial herpes is that normally it occurs on your oral cavity or on your lips, most commonly infection. But what happens is that nowadays what is happening, that our sexual practices are changing a bit, and it is changing or to oral sex. So in that case, because of that activity, now HSV1 can also be isolated from the genital lesions in a patient. Okay, this is an important point. Moving on to the second type of virus, that is HSV2, and a major focus here in this disease will be on HSV2 virus. Why? Because it causes genital herpes. Okay, so there are some important terms that you should know before you actually start the disease, because they're very important. So first is primary infection. Now there is a first primary infection and there is a first non-primary infection. So there's a difference between both of them. So first primary infection is that there is a person who has acquired or who has come across for the first time in his life infection with herpes simplex virus 1 or either 2, any of the form of HSV virus. First time in his life he has acquired that infection, so that patient is called first primary infection. But what if that patient has first, suppose has acquired an infection of HSV1, like an orolabial infection in his childhood, okay, but afterward he has again acquired an infection because of HSV, but this time with HSV2, or either ways, if first with HSV2 then after HSV1, means there is subsequent infection to a patient with the other type of HSV1. But still, to understand here is that new type of virus, the patient is infected for the first time. So that is why it is called first but non-primary infection. These are two very important terms. Moving on to the recurrent infection. Now what is recurrent infection? That a patient has already been infected by either HSV1 type or HSV2 type, okay, but in his life later on, at that time he become recovered of the disease, and then later on any point of his life he again got infected by either of the type. So that is because of reactivation of the dormant virus, and that you'll exactly understand after I'll explain you the whole pathophysiology. So this is basically recurrent infection. Three important terms we studied here: primary infection first non-primary infection, and the recurrent infection. Now we're going to discuss the pathophysiology of the disease, that how basically this disease occur, and how its symptoms develop. Okay, so starting with the first one is the primary infection. Okay, primary infection, and we will be focused on HSV type 2 virus because that is causing majorly the genital herpes, so we'll stick to that. Suppose there is a patient who is infected by HSV type 2 virus. Now what will this virus do? It will come on his genital area, and there first of all it will produce an erythematous, means a reddish plague. Okay, now later on this plague will then become changed into vesicles. Now very important, vesicles are in the form of groups, so these are grouped vesicles. Later on, if we don't treat it, so ulceration will develop within these vesicles and they will turn into blisters. Okay, blisters are of course larger vesicles, and those blisters will appear as if pus is oozing out of them. This is the whole pathophysiology of primary infection. Okay, now during this primary infection what happens, that a patient this virus, it goes down underneath where nerves are present and nerve ganglion are present. Fine. So this virus goes, it you can say goes into the nerve and the nerve ganglion and rests there as a latent phase or in a dormant phase. Okay, now when it rests there as a latent or dormant state, it just like you can say that a person has went to a rest house to prepare his army to attack with a much more stronger force on the person or on their enemy. Fine. So similarly, this HSV virus, first it comes, it causes the primary infection disease, but disease soon get treated by using antivirals and etc. We'll study later on. And if what happens that this virus, it goes down into the nerves and in the nerve root ganglions, then there it can rest in latent and dormant phase, prepares itself for fight against his enemy more strongly, replicate there, and just stays there in the dormant phase. Fine. But now, how will the recurrent disease occur after this all pathology? What will happen that later in life, if there is any precipitating factor that the patient encounters, like he is in a stressful condition or his nutrition is not proper, like malnutrition, or during menstruation your defenses become weak, or sunlight exposure or trauma, so any of these precipitating factors when come in the patient's life, this virus which was in the latent or dormant state will now get reactivated, and now this time he'll cause a disease, and this is basically called the recurrent disease. Okay, and but this time the symptoms which will appear, that will be less severe as compared to the primary infection. So this is the whole pathophysiology of this disease. Moving on, that how will the patient presents to you, like the clinical features of this disease. So primary infection, the already things we discussed, like vesicles will be present on the genital areas, vesicles and blisters will be seen. Okay, now what is the site of the ulcers? Coming down, if you look your if you come on the organs or the anatomy of the pelvic area, vagina, fine, going inside cervix, that is an important site. Then the introitus. Now what is an introitus? Basically it means opening of the body cavities, and here you can say it's vaginal opening. Okay, so that is the most common site of primary infection. Then outside labia majora and all the perineum area, these are the sites of the genital herpes where these ulcers can develop. Okay, genital ulcers. Now these ulcers, they are very painful ulcers, it's a very important sign. They will be associated with dysuria and urinary retention, plus the vesicles and blisters, they can be secondarily infected by some bacteria. If that happens, then bilateral inguinal lymphadenopathy, means our inguinal lymph nodes will be enlarged, tender, swollen, that can be seen in the patient. And flu-like symptoms, some patients present with the flu-like symptoms also. Okay, talking about the recurrent infection. Now in the recurrent infection, first of all, symptoms are produced, but they are less severe than the primary infection. And importantly, we have discussed in pathophysiology that nerves are involved, our nervous system is involved. So because of it, what will happen, that patient can have meningitis, inflammation of the meninges, within it is present brain, encephalitis, inflammation of the brain, so that can occur in the patient. And now the nerve root ganglion, which is most common here in causing the recurrent infection, it can be an MCQ, that is posterior nerve root ganglion. Okay, these are all the features by which the patient will present to us. Now how we will diagnose the patient of the disease genital herpes, now we're going to discuss the diagnosis. Now just to easily remember the diagnosis, like the whole diagnostic points, first of all, what is happening in the disease, look at just listen carefully. Basically virus is coming, that is causing the disease. Okay, now virus is basically acting as an antigen to our body, and our body in defense is producing antibodies against it. Okay, so just remember these three words: virus, repeat with me, virus, antigen, antibodies. Okay, now this virus, we have to first of all isolate this virus from the genital area or the genital blisters or the infections or the ulcers that are produced. So what we'll do, we'll take a swab of the genital ulcers and we will identify the virus from it. then we can send the sample for PCR, polymerase chain reaction. This PCR is the investigation of choice for genital herpes. Plus less sensitive tests that we can go for culture of the herpes simplex virus from the sample we took. Then moving on to antigens. Now we can identify the antigens of the virus by two major techniques, ELISA or immunofluorescence assay. Fine. Antibodies by serologies, of course, like IgG or the IgM antibodies, which are specifically produced against HSV, they can be identified by serology. So this is the whole diagnostic points that you should know how we will diagnose this patient. Okay, now coming back, now we are going to discuss that. Okay, we have diagnosed the patient, we have labeled it that it is genital herpes. Now how we will treat the patient. Okay, now starting with the treatment, first of all we'll take some general measures on the patient. Just recall with me, we studied that they are painful ulcers. The ulcers, they are very painful. Fine. So plus secondary infection can occur which can lead to the bilateral local lymphadenopathy. So for all these problems, first of all, ulcers, the lesions, we have to, first step is frequent washing of the lesions with normal saline. Now what it will do, it will provide a soothing effect. Also it will contribute in decreased spread of the disease. Okay, secondly, since patient is in pain, so we will ask him that you go for bed rest, take proper rest. That we can ask the patient. We talked about pain, so we give local or systematic analgesics. To avoid the secondary infection we discussed, antibiotics are given. Okay, now moving on to the specific treatment, how we will specifically treat the patient. That is the first of all, if the patient is having primary infection like we discussed before, so what we'll do in that case, we give of course antivirals because it's an it's a viral infection. So we give acyclovir, that is the drug of choice here, or it's another drug of its family, valacyclovir. Now if there is primary infection, then acyclovir 400 mg, valacyclovir 500 mg is given for 10 days. Okay, and why we give it, we just give the drug immediately to the patient as soon as we diagnose it, so that we can avoid the disease to spread largely and virus to go in the nerves, and then there will be a complication of reactivation and recurrent disease and so on. And secondly is that for recurrent infection. Okay, now for recurrent infection we have two types of therapies. First is episodic therapy and second is the suppressive therapy. Now suppose if the patient has the recurrent disease developed, but it is very mild symptoms and infrequently the symptoms occur, so we just simply give acyclovir or valacyclovir same doses, but this time just for 3 days to relieve the symptoms. But what if the patient is having a disease that is like greater than 6 outbreaks per year? In that case we go for suppressive therapy. Okay, now what is suppressive therapy? That we give this acyclovir and valacyclovir every day to the patient, so that his frequency of the outbreaks reduces and we can easily treat that patient. Okay, moving on to now, since we are talking here about of course gynae, so mother. Now suppose if the infection, primary infection or the non-primary infection, mother has acquired that infection during the 3rd trimester of her pregnancy. Now we know that it can spread through the birth canal, since it is a sexually transmitted disease. So during childbirth what we'll do is that during childbirth the HSV, it can spread to the child, to the neonate that the mother will give birth to. So what we'll do is that here the mode of delivery that is preferred for that mother is we go for pre-labor C-section. Why? We'll avoid the contact of the neonate to the birth canal, so that he or she doesn't acquires the herpes simplex virus. Fine. In that case, preferred mode of delivery is pre-labor cesarean section. But what if the mother has developed an HSV infection, and there is clear evidence that she is having recurrent infection during pregnancy? Then we can go for vaginal delivery. Why? Because previously the patient was having the disease, and he was having she was having IgG developed during the first infection. That IgG will pass through the placenta, go to the child, and the child will develop automatic immunity against the herpes simplex, so we can easily go for vaginal delivery, provided if there are no other risk factors for that patient. Okay, so this is the whole discussion of genital herpes. We have discussed it completely. I hope you liked the video. If you do so, please like, share and subscribe, and please share the videos with other fellows so that Max can avail the benefit. Thank you so much. Allah Hafiz.